Hi guys, okay, my name is Rosie and welcome to my channel. Here we give tips on how to beat depression and return to a life full of joy. In this video, you'll find out how to identify when a child is suffering from depression and how you can help them turn around. But first I kindly ask you to subscribe to our channel, like and share the video so that more people can be reached with this knowledge. Guys, depression is a very serious illness. It's different from sadness. Sadness is a normal reaction to situations that generate frustration and discomfort. Through sadness we learn to accept reality and change our way of dealing with it. Furthermore, sadness awakens care and help from other people. It is an emotion that calls for support. Feeling sadness is natural and to a certain extent adaptive. We should not avoid it, but accept and help children and adolescents to deal with it. But when do you suspect that sadness is not normal? And how to differentiate sadness from depression? Here are some tips. First tip. Sadness is transient and temporary, usually from minutes to hours, after the child returns to a calm state and tends to be cheerful. In depression, the state of sadness, discouragement, lack of interest, lack of pleasure and even irritability tends to be continuous, lasting several days, weeks and even months. This depressive phase to be depression must last at least 2 weeks. Second tip. In depression, children and adolescents have persistent negative thoughts, or about them, how to find the body ugly, if find it boring, stupid, without friends, having excessive guilt, or about the world, with pessimism of finding things always going wrong or having a hopelessness of thinking that things can't get any better in the future. Third tip. Depression has biological changes, such as sleep disorders. The child has difficulty sleeping or sleeps less. This is called insomnia or oversleeping, which is hypersomnia. Appetite change such as loss or increased appetite. Energy change with agitation or delay, psychomotor and concentration disorders. Fourth tip. In sadness, the reaction is often linked to a single environment. For example, a sadness that is related to school, while at depression this sadness remains everywhere, whether at home, at school, at the home of relatives, or at the home of friends. Fifth tip. In depression, there is a significant loss in the lives of children and teenagers. In general, the person fails to take care of themselves. Children often fail to clean themselves, do not shower, fail to eat, school grades drop. The report card gets much worse grades, there is social isolation, the child alone wants to stay in her room, doing nothing and no willingness to do any activity. Sixth and last tip. In depression, in more severe cases, people have thoughts of getting hurt, which we call self-injury, often without suicidal intention, or even dying, even constructing a suicide plan and making suicide attempts if they are not helped. If any of these signs are present in your child or a child you know, quickly see a child and child psychiatrist teenager to help children and teenagers. Depression appears more often in teenagers, but may be present in children from early childhood. Some of the most well-known causes are significant difficulties in dealing with frustration, low emotional flexibility to deal with change, neglect, physical and emotional abuse, physical abuse and sexual abuse from parents and others. Bullying is also a well-known cause that can trigger depression, so keep an eye out for symptoms and causes of depression. And how to deal with a depressed child. Living with a child with depression is not easy, but parents, family members and teachers must help the child to overcome the disease so that they feel supported and that they are not alone. So, one should respect the child's feelings, showing that they understand them. Encourage the child to develop activities they enjoy without causing pressure. Praise the child constantly for all small acts and not correct the child in front of other children. Give the child a lot of attention, stating that they are there to help. Take the child to play with other children to increase interaction. Do not let the child play alone or stay in the room alone watching television or playing video games. Encourage eating every 3 hours to stay nourished. Keep the bedroom comfortable to help your child fall asleep and sleep well. These strategies will help the child to gain confidence, avoid isolation, and improve their self-esteem, helping the child to be able to cure depression. In the description of the video, I left the link to a solution that can help you or someone who is suffering from this disease. I hope I helped with these tips. A hug, stay with God, and until the next video.